Hello, this is Dr. Gay from First Look MRI, and this is a 58-year-old gentleman who complained of an injury a couple of months ago, continued knee pain, and finally went to his doctor who ordered the MRI. And here we see a sagittal fat-suppressed protein density sequence where marrow is dark. It looks nice and uniform. We see the femur here. We see the patella, kneecap over here on the left. Here's the front. We see the tibia down below. And of note, we see the ACL, the anterior cruciate ligament, looking normal. Normal in orientation, normal in signal, so no ACL tear, thankfully. This is his PCL, posterior cruciate ligament, looking good. Over here towards the left, we see the quadriceps tendon that's abnormal. A normal quadriceps tendon will be uniform in signal, very dark, looks like a nice dark cable, but this one is greatly expanded. It has streaks of bright hyperintense signal within it. So this looks like either a hypertrophic partial tear or hypertrophic tendinopathy, which means it's irritated and inflamed and thickened with edema between the longitudinal fibers, but it's not completely ruptured, but diffusely abnormal. Down here below the patella, we have the patellar tendon that comes off the bottom of the kneecap here, all the way down to the tibial tubercle, the front of the tibia here. And this is also diffusely abnormal. It's intermediate signal throughout on this, streaks of high signal here on this view. So diffuse abnormal signal in the patellar tendon, which is very unusual. There's also a little scalloping here in the anterior tibia, in the tibial tubercle, which is unusual. And when we see the diffuse abnormal signal within the tendon with bony changes where they attach, we think of a synovial inflammatory process and enthesopathy like gout or psoriatic arthritis. So this is probably related to some synovial inflammatory process or enthesopathy like that. He also had some diffuse edema in the soft tissues in front of the patella and tibia. These are the prepatellar, pretibial subcutaneous soft tissues. And he has one more thing, and the reason I'm showing this video is for this last finding right here. There's an area of brightness here behind the patellar tendon, in front or above the tibial tubercle. And this is called the deep infrapatellar bursa. So this is the patella, this is infrapatellar, below the patella, and it's the deep infrapatellar bursa, which means it's behind the patellar tendon. Sometimes we see a little bit of fluid in here, sometimes low-grade inflammation. This is severely inflamed, very large deep infrapatellar bursal effusion with areas of intermediate signal, probably some synovial inflammation, and it looks like this process is continuous with this little enthesopathic erosion here. So a case of deep infrapatellar bursitis associated with the hypertrophic quadriceps tendinopathy and patellar tendinopathy here, and again maybe related to some synovial inflammatory process. Sometimes they can have a traumatic event that irritates things, and some people will call this a tear, but really this is probably more of a long-standing inflammatory process and maybe a superimposed injury on top of that. He did have one more thing. He had a tear of his lateral meniscus here that may have also happened recently. This is his medial meniscus, looking normal, a little black triangle. Beneath the femur, there's the medial femoral condyle. There's the medial tibial plateau and a nice normal medial meniscus, a little black wedge here. And this is the lateral meniscus. You can see the difference. Instead of being a nice uniform triangle, beautiful little wedge, this has a horizontal band within it. So increased signal within that lateral meniscus body. And looks like it may contact the inferior articular surface here. So in a case of deep infrapatellar bursitis, a rare example of like a really large inflamed deep infrapatellar bursa. Thank you very much.